If your Medicare Advantage plan is making you wait for approval of a test, procedure, piece of medical equipment, or another medical service, write down two numbers, 72 hours and 7 calendar days. As of January 1, 2026, Medicare Advantage organizations covered by a federal prior authorization rule generally must send a decision within 72 hours for an expedited or urgent request and within 7 calendar days for a standard or non-urgent request. But listen carefully, because this is a decision deadline. It is not a guarantee that the plan must approve the request. It does not mean every request automatically becomes urgent. And this particular rule does not cover prior authorization for prescription drugs. Those boundaries matter. A plan can still approve, deny, ask for more information, or in certain circumstances take a permitted extension. The important change is that you now have a clearer clock, a clearer reason to document every contact, and a stronger question to ask when your care seems stuck in review. Stay with me, because I am going to give you a one phone call checklist that can help you find out when the clock started, whether the request was marked urgent, whether the plan took an extension, and what exact reason it gave if the answer was no. Before we go further, subscribe if you want Medicare, Social Security, and senior money rules explained in plain English. These rules often turn on one date, one form, or one sentence in a notice, and that detail can change what you should do next. First, make sure this rule actually fits your situation. The 72-hour and 7 calendar day deadlines we are discussing apply to prior authorization decisions for medical items and services from impacted payers, including Medicare Advantage organizations. A medical item or service could involve something such as a planned procedure, a diagnostic test, therapy, home health-related services, or durable medical equipment, depending on your plan and the service involved. This is not a general rule saying Original Medicare must decide every coverage question within 72 hours or 7 days. Original Medicare has its own coverage and prior authorization processes for certain services and equipment. It is also not the rule for prescription drug prior authorization. Drug coverage decisions follow separate Medicare Part D or Part B drug rules depending on the medication and how it is covered. So the first question is simple. Is this a prior authorization request for a medical item or service under my Medicare Advantage plan, or is this a drug coverage request under a different process? Do not let the words prior authorization fool you into assuming every request follows the same clock. The type of coverage matters. Second, find out whether the request is standard or expedited. A standard request generally carries the 7 calendar day decision timeframe. An expedited request generally carries the 72-hour timeframe. But a request is not urgent simply because the patient is worried, the appointment is approaching, or the provider uses the word important. The health situation must support faster handling. A Medicare Advantage enrollee can ask for expedited treatment of a request. The plan must expedite it when applying the standard timeframe could seriously jeopardize the person's life or health, or the person's ability to regain maximum function. Here is the part many people miss. When a physician supports the expedited request and indicates that waiting for the standard timeframe could create that serious health risk, the plan must process the request as expedited. The doctor does not have to repeat a perfect legal sentence, but the medical urgency should be stated clearly. So do not call the plan and ask only, "Is this urgent?" Ask your provider, "Did you submit this as an expedited request or a standard request?" Then ask, "If it was expedited, what medical reason did you give the plan for faster review?" If the office says it submitted a standard request but your condition has changed, ask whether the physician believes the delay could seriously jeopardize your health or ability to recover. That is a medical judgment for your treating professional, not something a YouTube video or customer service representative should invent. Third, identify the exact moment the clock started. Do not count from the day the doctor first discussed the service. Do not count from the day the appointment was scheduled. Do not automatically count from the day you signed a form at the clinic. The key date is when the plan received the prior authorization request. That is why your first call should usually be to the provider's prior authorization or referral department. Ask for the person who handles insurance approvals, not only the front desk. Write down these questions. What date did you send the request? What time did you send it? How did you send it? Portal, fax, phone, or another method? Do you have a confirmation number, portal status, fax transmission report, or other proof that it was received? What exact service, procedure code, or item was requested? Was all supporting medical documentation sent with it? Then call the number on your Medicare Advantage plan card and ask the plan, "What date and time does your system show that you received this prior authorization request? Is it classified as standard or expedited? What is the authorization or reference number? What decision deadline are you using?" For a standard request measured in calendar days, weekends, and holidays count. In Medicare's plan guidance, the day the plan receives the request is not counted as day one. Day one is the following day. For a 72-hour request, focus on the exact received date and time and ask the plan to state the deadline. Do not rely only on your own calendar math. Ask the plan representative to say the deadline out loud, then repeat it back. You might say, "So you are confirming that the plan received the request on Monday at 10:15 a.m., that it is expedited, and that your decision deadline is Thursday at 10:15 a.m. Is that correct?" Write down the representative's name or identification number if available, the date and time of the call, and the answer. Fourth, understand what the plan must do by the deadline. The plan must send a decision. That decision might be an approval. It might be a denial. It might also involve a request for additional information as part of the process. This rule does not say the plan must approve every medically requested service. It does not replace Medicare coverage requirements. It does not make every doctor's recommendation automatically payable. What it does is place a maximum decision timeframe on covered prior authorization requests and require more transparency when the answer is no. Beginning in 2026, impacted payers must provide a specific reason when they deny a prior authorization request for a medical item or service. That word specific matters. A vague answer such as not covered, criteria not met, or insufficient information may leave you unable to tell what needs to be corrected. You need to know whether the plan believes a document is missing, a clinical criterion was not satisfied, the service was not considered medically necessary, a different service must be tried first, the provider is out of network, or another plan rule applies. Ask, what is the exact reason for the denial? What clinical or coverage criterion did the plan say was not met? What document or medical information was missing? Can the provider resubmit the request with additional information? Where is the written decision and when was it sent? The specific reason can help the provider decide whether to correct a missing document problem, submit additional medical evidence, request reconsideration, or help you file an appeal. Do not stop at the word denied. The reason underneath the denial determines the next move. Fifth, ask whether the plan took an extension. Keep the main clock simple. The first deadline is still 72 hours for an expedited request or 7 calendar days for a standard request. In limited circumstances, a Medicare Advantage plan may add up to 14 calendar days. You do not need to calculate several possible totals in your head. You need the plan to tell you, in writing, whether it extended the request and what the new deadline is. An extension is not supposed to be a silent excuse for ordinary delay. It may be allowed if you ask for more time. It may also be allowed when additional medical evidence from a non-contract provider could change a decision that would otherwise be a denial. And it may be allowed because of extraordinary, urgent, or other non-routine circumstances as long as the delay is in your interest. The important phrase is in your interest. The extra time is not meant simply to give the plan more time to support a denial. If the plan extends the time frame, it must send you a written notice explaining the reason and tell you about your right to file an expedited grievance if you disagree with the extension. So ask the plan directly. Has an extension been taken on this request? Who requested it, and why was it considered in my interest? What information or unusual circumstance caused the delay? When was the written extension notice sent? What is the new decision deadline? Then call the provider and ask whether the plan requested more records, which records it requested, and when the office sent them. A missing medical note, therapy record, imaging report, failed treatment history, or physician statement can hold up a request. Your job is not to practice medicine or build the clinical case yourself. Your job is to make sure the provider and plan are talking about the same request, that any requested records were actually sent, and that nobody assumes the other side already handled the problem. Sixth, know what a missed deadline does and does not mean. A missed deadline does not automatically approve the service. Do not schedule an expensive non-emergency procedure and assume the plan must pay simply because the clock expired. Confirm coverage before taking on a cost unless your medical situation requires immediate care and your providers advise otherwise. However, a missed deadline is not meaningless. Federal Medicare Advantage rules say that when the plan fails to provide timely notice of its initial decision, that failure itself counts as an adverse organization determination and may be appealed. The first appeal is generally called a reconsideration, or a Level 1 appeal. That means the answer to a missed deadline is not, "I guess I have to keep waiting forever." The answer is to document the missed deadline, contact the plan, ask for the status in writing, and ask how to exercise your appeal rights. Use this sentence: "My plan received a prior authorization request for a medical item or service on this date. The applicable decision timeframe appears to have passed. Please confirm whether the plan issued a decision, whether an extension was taken, and how I can exercise my appeal rights if the decision was untimely." If the plan says it issued a decision, but neither you nor the provider received it, ask where and when it was sent. Check the member portal, voicemail, email preferences, and mail. Also ask the provider to check its authorization portal, fax inbox, and electronic health record messages. If the plan says the request was never received, compare that statement with the provider's confirmation number or fax report. Ask the provider to resubmit promptly, and ask the plan how the original transmission will be handled. Seventh, separate 3 different problems: an unanswered request, a denial, and a complaint about service. An unanswered prior authorization request is a timing problem. A denial is a coverage decision that may be appealed. Poor customer service, failure to send required notices, or unreasonable handling may also support a complaint, sometimes called a grievance. These processes can overlap, but they are not identical. If you disagree with the denial of a service, supply, or item you believe the plan should cover, follow the appeal instructions in the plan's written notice. Ask your provider for medical records or a supporting statement that addresses the plan's specific denial reason. If waiting for the regular appeal timeframe could seriously jeopardize your life, health, or ability to regain maximum function, ask whether an expedited appeal is appropriate. If the problem is that the plan missed a deadline, failed to send a required notice, or is not addressing a complaint, contact the plan and then call 1-800-MEDICARE for help. You can also contact your state health insurance assistance program, commonly called SHIP, for free, personalized Medicare counseling. A SHIP counselor can help you understand the notice, organize the timeline, and identify the correct appeal or complaint path. Do not call a number posted by a stranger in a video comment. Use the number on your plan card, 1-800-MEDICARE, or your official state SHIP contact. Now let me give you the full one phone call checklist. Before you call, have your Medicare Advantage card, the provider's name, the requested service or item, the date of submission, and any confirmation number in front of you. The 9 questions are easier to remember if you put them into 3 small groups. First, establish the clock. 1. What date and time did you receive the request? 2. Is it standard or expedited? 3. What is the exact decision deadline? Next, find out whether anything changed the clock. 4. Has the plan requested additional information? 5. Has the plan taken an extension? Why was it taken? And where is the written notice? Finally, get the outcome in the next step. 6. Has a decision been issued? 7. If it was denied, what is the specific reason? 8. Where is the written decision? And how do I request a reconsideration or appeal? 9. What is the reference number for this call? Do not rush through all 9. Handle one group at a time, the clock, any delay, and then the decision. After the call, write a short summary while the conversation is fresh. Keep screenshots of portal messages, copies of notices, fax confirmations, names, dates, and call reference numbers in one folder. Here is the full picture. For Medicare Advantage prior authorization involving medical items and services, the federal decision clock is generally 72 hours for expedited requests and 7 calendar days for standard requests as of January 1, 2026. Those numbers describe when a decision must be sent. They do not guarantee approval. The rule does not apply to prescription drug prior authorization, and it is not a blanket rule for original Medicare. A doctor-supported urgent request can qualify for expedited handling when the standard delay could seriously jeopardize the patient's health or ability to regain maximum function. If the plan denies the request, ask for the specific reason. If the plan takes an extension, ask why it was considered in your interest. Ask for the written notice and write down the new deadline. If the plan misses the deadline, do not assume automatic approval, but do not accept endless silence. Ask about your Level 1 appeal rights. Contact 1-800-MEDICARE and get free help from SHIP if you need someone to walk through the paperwork with you. If you have been waiting on a Medicare Advantage prior authorization, how long has the plan kept you waiting? You can share the number of days in the comments, but never post your Medicare number, medical records, address, phone number, or other private information. Subscribe and share this with someone who uses Medicare Advantage or helps a parent or spouse manage medical paperwork. A simple timeline, one confirmation number, and the right question can make it much harder for an important request to disappear into the system.